Hi, everyone, and welcome back to the latest edition of CouncilCast, the official podcast of the Council of Insurance Agents and Brokers. I'm Katie Oberkircher on the Market Intelligence team here at the Council. Today, I'm joined by Ryan Rice and Garrett Jerue from Prism, a new consulting firm specializing in pharmacy consulting. Ryan and Garrett are going to break down what's led them to create Prism, why their operating model is different, and how they're faring in an industry that's increasingly scrutinized for its lack of transparency. Ryan and Garrett, thanks for being with me today.
Great to be here, Katie. Yeah, thanks, Katie. It's a pleasure.
Garrett, let me start with you with a big picture question. What was the aha moment that led you to start Prism? What was that gap that y'all were wanting to fill?
Yeah, I think that's a really good place to start. You know, Prism itself was being made by Ryan and myself months before it actually became what it is, but it really came down to putting together and seeing a bunch of these different PBM contracts for myself. I had been a consultant and worked in that space with a lot of large employers. And when I went to put all these contracts side by side, I started realizing that one PBM's definition didn't match the others. And when I would start to ask questions, and I started to ask questions of Ryan Rice, and he seemed to really understand this space. And when we got into it, I finally felt like I needed to take a shower by the time I was done reading them, because I couldn't understand how things could be so different with very small words, if you will, in these contracts. So I really leaned on Ryan, and we ended up working on a couple different cases together where I really wanted to make sure that I was getting to know it even better, and then better, and then better. And then there's days, of course, where I had to look at this and say, gosh, there's something here that I got to be honest with myself about. I'm not that good at understanding everything in here, and I need some pros to help me. And so I basically decided I wanted to start an all-star team of people that knew this space, that were excited about it, and really wanted to challenge what was out there. And that's kind of how it got started for me.
Yeah, it was a great opportunity for Garrett and I to roll up our sleeves. In fact, we noticed it most prevalently with a very large Wisconsin employer where the consultant, as well as the PBM, the employer was made to believe that, wow, we've got a great contract. Who are you to say that we don't? And when we pulled back the curtain, their eyes were opened up, as in the first year alone, they saved $2.5 million plus on $9 million in spend. So that in and of itself, I think, created this genuine desire to help people seek actionable transparency, to empower them with the tools and resources and expertise, more importantly, for a very complex part of the marketplace.
Yeah, absolutely. And Ryan, I know you have a background in pharmacy. You've worked at Express Scripts, Navitus. Those are two very different entities. So just sort of following those threads of a lack of transparency and a lack of standardization in contracting among PBMs, there's been a lot of buzz around the industry in general around the issues with lack of transparency. Within the administration and Congress, they've started to take notice as well. A lot of new regulatory proposals, lack of pricing information, higher costs, they're all revolving around this idea of being more forthcoming with certain information to allow consumers and all stakeholders to make better healthcare decisions. And you founded Prism with the intention of being upfront, unbiased, and outcomes driven. How are you talking about this with your clients? How are you bringing up the idea of transparency?
Yeah, it's a great question, and it's really the foundation of what it is that we do and why. So, pharmacy is, probably the most frequently used components of the healthcare benefit by most folks, and it's now also representing the fastest growing segment of spend. at 25 cents on the healthcare dollar. So these are really important metrics to have our fingers on the pulse. One of the things that in my 11 plus years of doing this, I've come to learn in working for the good, the bad, and the ugly, and even I kind of jokingly say helping ultimately bury some of the skeletons. I still have the shovel. Now that I'm on the side where truly trying to seek what's best for those that we partner with, I think that it's great. It's comforting to know that transparency as a concept has really been adopted by many in the marketplace as the gold standard. That's great. We want to see more of that. And the activity in Washington, the aspirations to become more accountable, those are all things that we like to see as consultants in any market that we serve, managed care, union groups, as well as direct-to-employer organizations. Unfortunately, though, we find that transparency has become kind of a subjective term rather than what we believe should be an achievable expectation. The market is just flooded with catchy hashtags and buzzwords and what seem to be band-aids for a problem that is just continuing to grow out of control. And in many ways, it seems as if folks wanting to wield this sword of transparency either don't know how to swing it, or they find that they get over their skis and that they've brought a knife to a gunfight. So we believe that transparency is something that is achievable. It's something that must transcend the contract above all. And we oftentimes work off of the expression that you don't get what you deserve, you get what you negotiate. And in many cases, having an experienced advocate on your side to be able to determine definitions, the precise way of using words to your advantage, and ensuring that the PBM doesn't take a little bit too much liberty in how they assume one thing is to be factored into a contract and how pricing can be manipulated. So it's really important that those that we serve know that how we view transparency is very clear, in that it's not just this concept or a pretty idea, it's something that you can validate. And in order to be viewed as this unbiased and very clearly committed advisor or consultant, our firm is based on the premise that you have to be able to validate what you're putting out there in the form of consultative guidance. And it has to be aligned 100% in full transparency of those that you serve.
Absolutely. And before we move on to thinking about who your ideal client is, I just want to, I have to ask what the PBM reaction has been to Prism so far, and some of the ideas that you're talking about around transparency.
Yeah, well, that's a good question. So this isn't my first rodeo here, in that previously served as a pharmacy benefits consulting in another role previous. And so I'm used to some of the reaction that we're now getting on this end. And so it's been a bit of a mixed bag, quite frankly. We're getting some discontent as well as loud applause. And, we've been doing this for about a year and a half now. And I think the PBMs that are misaligned and serve a model that is wrought with undisclosed spread and, disingenuous terms that are really designed and meant to bolster Wall Street initiatives and prop up shareholder earnings, they don't like our model, because we take, even the name Prism, a prism is a device used to focus light in to be able to use that to shed light where it's needed most. And our consulting firm, what we do for our clients is to do just that. It's to align with them, to show them ways in which they can very easily, as well as meaningfully, take control of the pharmacy spend. So a lot of the PBMs don't like that. But then there are some PBMs who do operate with the best of intentions for their clients. And so I think that for the longest time, spread models, disingenuous business tactics have been used. And now that we have kind of moved into this next phase of seeking transparency, it's those organizations that believe, hey, you know what, now we're going to get our fair chance at actually being able to tell why our model in particular does serve the greater good for those clients that we can mutually serve. So it's been mutually good and bad, I guess, the reception from some of the PBMs.
Well, I think that mixed bag of discontent and then applause from some, it's fun. I'm gonna be honest, like, this is a space that we've grown into over the last year and a half, with taking what we've both known for 11 years each in this industry and said, let's have some fun with this, and let's go out and help people and their employees understand that we're going to give them the lowest net cost at the point of sale. And so there's many ways we can do that. And the first thing, I know we'll hit on this here in a little while, is we needed to build the technology that we were going to serve on this platform to be that flagship, to where we could say, here's how we are going to actually prove out our model, and this is what you're paying for. And what you're paying for, by the way, is upfront, and that fee is disclosed to you before we even start working on anything, and we will take nothing else for this deal to get done.
Yeah, it's been really exciting. There's no question that our model is disruptive. I mean, for example, there's some of our competitors out there that have their own consortiums and coalitions, and we're not saying that those things are bad. We choose not to go down that pathway because we believe that that does not constitute an unbiased relationship. If you've got horses in the race there, it's pretty hard to say that, you know, choosing one option over the other is a clean and clear piece of guidance being given. So our model very clearly states that we will not operate coalitions, cooperatives, or have our own quote unquote deals behind the scenes. That's truly what it means to be unbiased as well as aligned with our clients.
I'd like to switch gears a little bit, Garrett, and talk about your ideal client and how you're hoping to partner with other brokerages.
Yeah, I think this is a really good question because over a career in doing this, you get to see who some of the best are in the country. You get to see, of course, like everyone, people I'm not going to be like. And so I really think our ideal client from a broker standpoint is one that looked in the mirror several years ago like I did and say, you know what, honestly, I do not know everything I need to know in this space. And I cannot feel good about taking a 100-page PBM contract and looking at my clients in the face and saying, you know what, this is exactly what that PBM meant by this phrase. So we wanted to make sure that we're aligning with people that go, I'm a really great broker and consultant because I want to do what's best for my clients, but then I want to make sure that I'm using the right resources to help in spaces, because it's one thing to be an expert in medical and then an expert in HSAs and FSAs and an expert in all the ancillary lines, and then to know all the things you need to know on the PBM space. It's just too much for a lot of people. And we feel like we have a very reasonable price point to give the help needed, that in a lot of cases, we find the money that pays for our services anyway during this process. So the ideal client is one that is honest with themselves, realizes that they might not know everything, one that really can take the time to go through the procurement process and want to do what's right for their client on an overall net cost basis. And also just getting into that language and understanding that you can't just maybe broad stroke this anymore, with pharma going to grow from 25 cents on the dollar of every healthcare spend up to 40 cents in the next 10 years. That's a really scary stat. And in Wisconsin, you know, we're one of the 4th highest healthcare states out there. So we've really had to dive into this. And again, if you're agnostic and you just pick what is the best PBM partner that's doing things with that contract, we think you'll be a really good fit for us too.
Yeah, and Garrett brings up a great point in that, you know, the right ideal client for us is those who are always seeking to learn more. We're always learning. And I think that being able to ask the question and not drum to the status quo is really, really important. We're good at this. We do a lot of direct contracting with PBMs. We write language, we write expectations that are not only achievable, but that are market. And we are seeking to align with those kinds of broker consultants out there who are also looking to accomplish those same things. And we find that with our solutions, not only can you have, leading thought leadership with regard to the pharmacy benefit, but also have a set and suite of solutions that will help you retain your clients, protect your client bases from being predated by the new shiny thing out in the marketplace by maybe those who are less honest than yourself, but then also to help go out there and gain new business through doing the right thing. I mean, there's nothing better than being able to capture a new relationship and build those bonds of trust by doing the right thing and saving someone a boatload of cash and making their employee base that much happier.
I'm going to add one thing, and it's to remember that there's humans on the other end of this process. For myself, I'm a cancer survivor. I know what it's like to be a $600,000 medical bill and actually having to change who I used for my care in the middle of treatment because insurance caused that change many years ago when I was on my parents' plan. I want people to understand that when you make decisions, fiduciary decisions like this, that if you're not partnering and aligning with someone that knows the fine print, you could ultimately be hurting how things work on the backside of it. And that could be for a child of one of your employees or one of your spouses or even yourself. And so that's really important that we align with people that understand these aren't just data numbers for data's sake. There's real people taking these medicines on the other side.
That's a good point.
Yeah, and healthcare is deeply personal. And I like, Ryan, what you said as well about wanting to partner with clients that are wanting to stay curious and learn more. And it's a simple idea, but I do think it's really important. So let me switch gears again. And I know, Garrett, you touched on this a little bit earlier, but I wanted to talk about your data analytics platform. How is Prism using data analytics to affect your pharmacy consulting outcomes?
Great question, Katie. And when we set out on this path, what was most important to us is to first and foremost figure out, who do we want to be in this marketplace that's already saturated with everyone calling themselves consultants. And I think that in order to truly gain not only credibility but also validation in what you're doing and why, you have to be able to put the proof in the pudding. And the way in which we have set out and made our identity is not only providing the thought leadership, the expertise in this pharmacy benefit management marketplace, but it's to underpin that with the ability to validate. And so our proprietary solution that we've developed is known as Prism 360. And our data analytics platform, it goes farther than simply being able to pivot into the same data. It takes the granularity, the pharmacy data directly from your TPA, your PBM, your insurance carrier, and through our HIPAA compliant AWS warehouse, we house that information, and then we pull it into the different views and swim lanes that measure several different components of the pharmacy spend in particular. Namely, we monitor the entire plan as it is, and so we empower, whether it's our broker, consultants, clients, or if it's the client themselves, in fact, even the health plan groups that we serve, to manage their entire book of business. It's used in a way that we organize the data to make it meaningful to that particular group. And so we're looking at the financial components. How are the guarantees or the performance of the financial metrics, how are they stacking up to the guarantee that's been set forth in that PBM contract? Same with the rebates. From a clinical point of view, are we able to then identify, are there opportunities for us to select into a specific therapy class and note specific trends, as well as overall utilization and performance channels? So it's really important for us to be able to provide that level of granularity at that claim level, as well as to provide the actionable outcomes necessary to have an impact. I mean, the days of simply providing reporting, it's over, or taking the PBM's word for it is over. Prism 360 takes in its own independent source of average wholesale price, Metaspan, It's also taking into account our own assumptions based on what the contract language says. Again, you don't get what you deserve, you get what you negotiate. And whether your contract says that there's the ability to offset performance via channel, or if there are unique ways in which rebates or network discounts are defined, those are all different considerations that we apply into our platform. And our ability to then make real-time assessments, as well as push notifications out to our clients, as well as our brokers, to inform them of specific performance instances. It's like setting an alarm to say, hey, when this happens, I need to be notified, so then we can make an action on it. Not 60 or 90 days in the rears when you sit down for your plan review and it's too late. That's old analytics, and it doesn't work in today's healthcare marketplace. We need actionable insights, and Prism 360 delivers that.
Well, the funny thing with truly looking in the mirror when you're a consultant and doing this, right, is when I got into my rights as to how I could audit a PBM contract and its performance when we were doing consulting was, hey, you can come in, but we need 60-day notice before you can audit maybe a fraction of your claims. You need to come on site to our PBM location to look at them, and we will tell you which claims you get to audit. And by the time you got through what your auditing rights were, is they had time to either clean up what might have been there, not share certain things, and it didn't make you feel good as a consultant saying, yeah, I know I negotiated a pretty good contract for you. I just can't really tell you if it actually worked or not based on I'm only hearing what the PBM wants me to know. And so the creation of Prism 360 allows us in real time to do that and feel really good about it at any point in time throughout that year. And it's pretty wild to see some of the ways in which things move throughout that year based on performance, or based on maybe when an earnings call is, or other things are happening. So it makes us feel like we can have brokers end that sentence with not a question mark, but more with an exclamation point that, yes, this is actually how I make sure that the contract performs and hits its guarantees.
Yeah, Garrett's right. It's about empowering our clients with actionable data. I think the differentiation between what Prism does versus what some of the other firms in the market can provide is that this information is 100% ingested within our platform directly from our clients themselves. And so that it's not being pre-scrubbed, it's not being selectively challenged by a PBM on the back side of things. You're truly getting an independent and unbiased point of view as to how things actually performed. What are the true drivers within the trend that you're seeing within your plan? And that's something that we know through experience can lead to lowering costs and improving the overarching benefit for those that we serve.
And I think it's an important distinction to say that your data is not just available in real time, but it's shared in real time, because I'm not sure that's totally the norm right now, but being able to ping a client or to let them know as soon as you validate what you're trying to find makes consulting look a little bit differently.
That's exactly right. And when you said that, it kind of triggered my other thought was the brokers that are listening to this that are also, they have that population of fully insured groups that are just trying to figure out are we ready to possibly look at self-insuring, whether it be on their own or through a captive? What does the pharmacy data tell us on making that decision? And any time that those consultants go after their own data on a group from a fully insured carrier, you will be not surprised that the answer is usually no, you can't have this or that, because it would tell you too much about our deal that we have on the backside. And that's where it gets a little sticky. And once you show and walk a fully insured client through that process, it really kind of sheds a light on how much anyone really wants you to know in the system in this space.
Yeah, one of the things that we provide our clients, all of our clients, is the ability, some of the negotiation practices to get that data. There's a lot of different ways that we've heard the word no and yet still ultimately get what we're after. Because in all cases, you're entitled to that information.
Sometimes you have to ask the question 4 or 5 different ways to finally get there, but at least we know how to ask those questions and really, again, raise that bar of what's allowed and acceptable. And it's more than just a conversation on rebates. It's more than a conversation on backing into the discount guarantees on a fully insured contract. It's really just saying, would it be so bad if our client understood where their pharma spend came from and how you arrived at that point and that price? And we think the answer is no. That'd be a good day when all that data is shared on both sides.
And I think it also harkens back to the point that was made earlier that transparency is subjective, and it just depends on the lens that you're looking through or what your business objective is.
Well, I think you're right. I think that a lot of people think about transparency, and if we're thinking about this a different way, I mean, I can still see through a smudged up window, but at the same time, I would much rather have a clearer picture if there was no window at all. And that's the way we view what transparency is. And that doesn't mean that it has to be a fully pass-through and transparent pharmacy contract or a traditional contract. Our point is that regardless of what the PBM's business model of operation is, there is a way to get to a source of truth in a transparent, reasonably agreeable circumstance that everyone can walk away feeling as if they have what they need to feel secure in the decision that they made.
Well, that's great. Sounds like big things are to come for Prism. Thank you, Ryan and Garrett, so much for your time. I really appreciate it.
As do we. Really appreciate you allowing us to be on here and just continuing to sharpen the blade of our fellow status quo movers out there.
Yeah, really a pleasure and a privilege.
Well, thanks again, guys. And thank you for listening to CounselCast. You can listen more on Apple Podcasts, Google Podcasts, or SoundCloud. Subscribe and leave us a review and tell us how we're doing. If you have any questions or comments, you can find us at ciab.com, at the CIAB on Twitter, or you can email in at counselcast@ciab.com. See you next time.